Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back, everyone. We are joined today on the Zoom and podcast with Barbara Greene. She's a certified orofacial myofunctional therapist. Excited for her to be back here to talk more about her company, Tongue Thrust. That's tonguethrust.com. And she's back today to talk all about the children, the adults that she's helping, with her unique exercises and really, doing so much to change people's lives. So first and foremost, thank you for that. And welcome back. How are you?
Thank you. I am good. I just wanted to, today, it was a bit upsetting yesterday to find out that a dentist that I highly respect and his father have actually lost their dental licenses just because they believe in doing something that isn't mainstream. In other words, they are orthodontists that were taught to be orthodontists, but they realized what they were doing was not really doing what was necessary for children to grow their faces bigger, to grow their mouths bigger and more in the correct position. Wow. And as a result, they created this wonderful philosophy called orthotropics, which to me is so exceptional because I've seen the difference. I've seen the they treat. And Dr. William Hang was one of the people that I referred to for many years, who was in my area. And he taught people all over the world how to do this type of work. And the sad thing is that the Dental Society doesn't necessarily agree with some of the people that are practicing like airway dentistry, practicing dentistry to treat children and adults differently, to give them better breathing mechanisms, to give them a bigger, more beautiful face and a mouth that can accommodate their tongue. And so instead, we have the opposite happening a great deal of the time, where they're taking out 4 bicuspids to make their mouths, to make it easier to do orthodontics. And in fact, we've had with orthodontists, and they tell you to your face, it is necessary sometimes. And I agree that there are people with smaller mouths than others, but you need to find a way to make that mouth bigger. And taking out teeth is certainly not going to be the answer. It's accommodating what they have and making it function in a better way. So it's very upsetting when dentists are losing license. And the same is true even with myofunctional therapy. There are some people who disagree that myofunctional therapy is valuable and that a dentist should not be using it in their office or referring to people. And yet I can cite you thousands of cases that I've personally treated that have no more headaches, no more pain. They have the ability to breathe through their nose instead of their mouth, are sleeping a full night's sleep instead of a terrible night's sleep. They have much better head, neck, body posture. They have sometimes an even bigger mouth, because when you get the tongue in the correct place in the palate, and it's there 24 hours a day, except when you're talking or eating, and you have a chance for that tongue to expand the palate. So it's not always going to happen, but it certainly does happen. So how do patients make a decision as to what they should?
Great question.
It's a difficult, very good question. And if you look at the medical practices and the pediatric medical doctors, And then you look also at the dentists who are being trained, and it's not being taught to them. Now, because people are dying from sleep apnea, sleep apnea has actually helped to put this bigger picture in the faces of the medical doctors. Maybe not of the pediatricians, but what they're doing is treating the allergies. They're treating the asthma, the congestion and colds. But what they aren't treating is the way that the body has to function to actually achieve normal function. So if you're mouth breathing, you're setting yourself up for airflow, not sufficient air. And then the tongue is always in the bottom of the mouth. And when they swallow, the back of the tongue isn't functioning correctly. And because things are not functioning correctly when they go to sleep at night, the uvula and soft palate and or the back of the tongue falls back against their throat and cuts off their airway. So then the body jerks them awake, saying, hey, I'm not getting enough oxygen here. And then they don't get a very good night's sleep all night long. And so it's an interesting thing. And I was debating today about tackling this issue because, as you can see, if a dentist is going to lose their license just because the dental society doesn't agree with airway dentistry or doesn't agree with the use of myofunctional therapy or doesn't agree with the use of orthotropics, it's a scary situation for as well as the doctors and their hygienists. And so it's not something that we can really take lightly. It needs to be that a patient can go to a professional and be told what to do correctly, not spending thousands of dollars. You know, I have a patient right now, she's living in Mexico just because she can't afford to live in the United States anymore. And she's a mess. She's an absolute, what you would call disaster. You know, she's missing, she spent a fortune to actually open up the spaces of the 4 bicuspids that were extracted, the child.
And then, by the way, could you just, what exactly are the bicuspids? Could you just share specifically?
Okay, these are the centrals.
And
then the next teeth are your laterals. The next 2 teeth are cuspids, the pointed teeth. And then you have 4 bicuspids, 2 up here on each side and 2 down here on each side. Then you have your 6-year and then your 12-year molars, and then you would have your 3rd molars.
And they're taking out,
everyone should actually be able to keep 32 teeth. Now, here's a problem that's happening. The skulls of people of our generation are much smaller than the skulls of previous generations. So if you go back 200 years, you look at the skulls, and I saw this totally when I was in Germany and at a museum, and there was a room full of skulls, shelf after shelf after shelf of skulls. And here's these beautiful big skulls, all 32 teeth, unless they had lost some teeth due to what reason, I'm not sure. But we just stood there in amazement of how big the skulls were. So there's proof right now that the skulls of today, when a child is born, is much smaller than the skull of previous children. And the skulls of adults are much smaller than previous adults. So genetically, we are influencing that. I have been told, Kevin Boyd is an incredible pediatric dentist in Chicago, Illinois, and he is a research fanatic and a research genius and is a fabulous writer of books and in trying to get this message out to people. But he said that the skulls of today are so much smaller in size, and there are babies being born now with only 4 bicuspids.
Oh,
We are so influencing genetics that,
wow.
and third sometimes are missing. Now, let me tell you, third molars are there for a reason. And a university in the Midwest did a research study. Why do we have third molars? They really aren't there necessarily for chewing. The 6-year molar and the 12-year molar, definitely. We need those for chewing our food.
Yeah.
But the third molars, they found out, are there because they prevent a concussion.
Wow.
So if you are in an accident or you are playing sports and you get hit and your head is hit really hard, the third molars are actually there as shock absorbers for the trauma and allow the brain to not be as traumatized. And so they're there to help prevent concussion. So, I mean, to me, that's so fast. Okay,
Yeah.
just that they discovered that.
Yeah.
But now here we are just routinely taking out third molars on kids in orthodontics. So mothers and dads have to become really, really their child's advocates to say, no, we're not making that decision. You have to find a way to make the mouth big enough
Yep.
to accommodate these teeth. And sometimes it takes going to several different people before you actually get the answers. Now, this woman that I'm seeing in Mexico, she's had the spaces opened up again.
Wow.
So they've moved her upper teeth forward. And so now she has 4 open spaces and braces. Okay. But now what they want to do, instead of filling those spaces, which you should do with implants and crowns, so that she has a big
wow.
Instead, they're going to do surgery and orthodontics, and they're going to move it all back.
Got it.
Well, what's going to happen when they do that?
Yeah.
Where's her tongue going to go?
Yeah.
See, so they're making her mouth smaller again, and it's a mess. And everything is so expensive. So a lot of the patients that I see as adults have so many issues. You know, they're in pain. They have neck and back pain. They have jaw pain. They have breathing issues. They have sleep apnea. They have a mouth that's too small and a tongue that doesn't fit. Now, I can help that by making the tongue, it's kind of like sending your tongue to a gym.
To school, yeah, for
making
training
it
camp.
work
It's like
out.
it's a workout. Exactly. I like that analogy. It's true. Every part of your body needs. You're right. Yeah, yeah.
It is. So that's exactly what we're doing, is training the muscles to work differently, okay, and in the proper position. So if your mouth is too small and you've had bicuspids removed, then it's a job to try to get everything to be happy with itself. Otherwise, the only answer is surgery.
Yeah.
You've got to get that mouth bigger. And so surgery is so outrageously expensive that now the insurance companies are no longer paying for the doctors. They'll only pay for the hospitalization and the anesthesia and that, but they will not pay for the doctor doing the surgery. And my surgery at a discount was $35,000 out of pocket. Now I'm hearing prices like $80,000, $90,000. That's just the surgeon. And so how do, people are making decisions about their health that aren't as good for them just because of the expense
Yeah.
and just because they don't want surgery. So then they're asking someone like myself to try to help them with a mouth that's too small and a tongue that's too big. So, we do our best, but sometimes it still isn't enough.
Yeah.
So they end up with a lot of periodontal issues. You know what periodontics
Yeah, I've heard
is?
it.
It's just your gum
Your
tissue.
gums, right? Yeah. People get
Uh,
that decay and all. Yes.
right, and they have gum disease, and then they have to have surgery and do grafts on their gum tissue. So it's a huge issue right now. And I just don't know where it's going to end up because the patient is the one paying the price.
Yeah.
And so, like today, if you were, I don't know if you have small children,
7 and
but
9.
when
Yeah,
you
two
have a
boys.
child, oh, well,
So
see, they're the
one actually,
primary
one is
age when
9.
you,
One has braces on already, like 2 here, and they put the palate expander in like a year ago. We're working on it because he had like his underbite like this, real bad underbite, which is yeah.
so he's, the type, or he or she is the type that you need to bring that upper jaw forward. Almost never is the lower jaw too far forward. They say that it is that third that in orthodontics they want that lower jaw farther back to match the upper jaw, but in orthotropic work you realize that it's the upper jaw that's in the wrong place. And so when they're young, that's when you need to be treating them to get that upper jaw higher up and more forward. So it's one of the things that right now is a problem is the diet of our children.
Yeah.
They are not chewing enough foods, really chewing on vegetables like carrots and things of that nature, and meats that cause them to have. What do we have? A new invention called pouches. And these pouches the mothers love because it's so easy to give a child a pouch and have them drink their meal. And I agree, pouches are great for like you're on a trip and somebody just needs something. Well, then a pouch works fine, but not for general drinking and eating food. They are terrible. So here we have a whole different problem of convenience.
Yeah,
So a
for
lot
sure.
of things are
Oh,
convenient. And we've so overscheduled our kids. Not
so
only do
true.
they have school all day, but then they have sports.
Oh,
Then they have
every
music.
night it's
Then
religion, it's church. Oh, it's baseball, it's soccer, it's football. I'm living this life you're describing. Ah, eating
it's
snacks on the
true. And
go.
then
No time for home cooked meals, healthy stuff. No, take a processed snack. I'm living this life right now.
exactly.
Yeah.
Yes. And so what do they end up with? French fries, things that, yes, it's food, but it's not food that's making their jaws grow.
No.
And it's not foods that are making their faces grow and their bodies grow. Well, they're growing. I mean, obviously, they're growing. But we're seeing so many problems as a result of not chewing food the way they should be chewing food. I mean, any food, any person should be chewing between at least 10 to 30 times. Like when I chew up a salad, a mouthful of salad, it takes me at least 15 to 40 bites of chewing.
You're
depending on what's in the stomach. So chewing has become an issue. Everyone is in such a hurry to eat, they're taking too big a bite and they're not chewing long enough.
Yeah.
And so what do they end up with? Digestion problems, gas, burping, hiccups, stomach aches, GERD. How many of my patients have all of that when I first see them? Almost all of them. And then they end up with a lot of other health issues as an adult. So if I can get rid of that, which I do frequently, then they have a much better health issue also.
Yeah.
So it's a thing that parents have got to realize, that their kids' lives are too busy. Their lives are too busy. Like you're working today,
Yeah. Kids get off the bus. I got to be there in an hour and a half. Yeah.
Right. And so it's such a major dilemma that we're facing, that we've somehow got to bring back, how do we want our children to grow up? And I'm having a problem with myofunctional therapy. The kids are supposed to do, and adults, exercises twice a day. And those exercises can take at least 30 minutes to do each time. Well, who has an hour plus a day to do those exercises when everybody is frantically going from one lesson to another lesson, and not that that isn't important. I understand that. It's great that our kids have sports and all that. But COVID proved that they didn't die without it.
Yeah.
They couldn't go all of that stuff during COVID. And yet they survived, without it. And sometimes it was the best thing that could have happened, because the kids got to just be.
I know. I agree.
That was important, So COVID was a blessing and a curse in so many ways. Still a curse, because a lot of people are still getting sick.
Yes.
And I have so many cancellations. And I've never had that many cancellations in my practice. And they go to school, they come home sick. They get better, they go back to school, they come home sick again. And it's like every week they're canceling their appointments just because they have a cold again, or they have the flu again, or they have whatever the label is. But I call it, it's just having still to deal with all of these illnesses.
Absolutely.
So we're almost out of time again today.
I know. You're so good for watching. Thank you.
Well, I just hope people have a better sense of how they need to protect themselves, and find clinicians who really know what they're doing and who care about the space in your mouth for all of your teeth, and how to prevent getting sick all the time, how to prevent getting gum disease, how to prevent getting jaw joint issues and headaches and neck pain and back pain all the time. They aren't normal things.
No.
They should be, your body should be able to exist without them.
Exactly.
So that's my thing for today is, please look for really, really good clinicians.
Beautiful. Thank you. And how do we contact you, Ms. Barbara Greene?
805-452-4302, or on my website, www.tonguethrust.com, or barbara@tonguethrust.com.
Beautiful.
Ta-da, ta-da.
Thank you so much. Always a pleasure seeing you, and thank you for chatting, and such good stories. Thank you again and to those out there who don't go by what's necessary. Horrible. All right. Thank you so much. I know we started off that way, learning about that orthodontist who lost his license, and the two of them. But all right. Thank you so much. Bye-bye.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.